Hello, my name is Natalia Ratner. I'm a PGY3 internal medicine resident at the University of Toronto. I'll be presenting our abstract for Predictors of Matching Success for International Medical Graduates in Canada and the USA, a scoping review. There are a large number of international medical graduates, IMGs, who apply to North American residency programs each year. In fact, in 2018, there were 2,478 IMG applicants to CARMS. 123, or 4.9%, were successful in obtaining a residency position in Canada. 55% of these were returning applicants. IMG applicants continue to apply to CARMS repeatedly with limited success. We believe this may be due to a lack of consistent information, as there are no clear guidelines which may contribute to the increasing number of unmatched IMG physicians. Future research is required to guide future IMG applicants and help the residency programs in the IMG selection process. Therefore, our objectives were to identify clear selection criteria to guide future IMGs, as well as assist the postgraduate programs in their selection of IMG candidates, and identify areas for future research. A scoping review was used due to the complexity and heterogeneity of the subject. Studies analyzed for the scoping review were obtained from 3 journal article databases, as well as the Gray literature. Studies were first filtered by title and abstract by 2 reviewers, and conflicts were then reviewed by a 3rd independent reviewer. The search yielded 799 non-duplicate articles, 40 of which were included in the final analysis. 15 of these 40 were included in the quantitative analysis. We found that the most important factor in the selection of IMG candidates for residency was standardized testing scores, such as the USMLEs and MCCQE, which were highlighted in 100% of the studies. Other important factors included letters of recommendation from known physicians discussed in 60% of the papers, and clinical or research experience in the country of application discussed in 53% of the papers. Standardized testing scores were deemed the most important in the selection process, but interestingly, it was noted that both foreign-born IMGs and US IMGs performed worse than US graduates. Letters of recommendation were also important in the selection process, but specifically if written by a writer known to the program director or at least in the country of application. Some of the literature highlighted previous postgraduate experience as a positive predictive factor, especially programs set up for graduates which allow IMGs to become acclimatized to the US system, providing the opportunity to demonstrate their abilities and gain letters of recommendation from US physicians, while another article found that having greater clinical experience can be both a benefit and a flaw, specifically if the experience was outside of North America due to differing cultures and styles in the country of origin. However, findings indicate that despite achieving the above criteria, just having an IMG status is strongly dissuading in the matching process. Overall, this review has identified several contributing factors to the IMG matching process, but we did find that there's limited Canadian literature on this subject. In addition, the studies represented a heterogeneous range of programs which have differing criteria in the recruitment of successful IMG candidates. Further research is necessary to guide future IMG applicants and postgraduate residency programs. Thank you very much.